Hi guys, thanks for joining me. I am Dr. Ayele Okine and this is This Vet Wants You to Know. I had some requests to chat about bloat, and actually the proper name for it is gastric dilatation and volvulus, or gastric dilatation with volvulus. And it's different from bloat in the medical terminology, because bloat just means a dilated stomach. And really what distinguishes this disease from something like food bloat is actually the fact that the stomach twists on itself. And that's what makes it extremely dangerous. Even though we consider it to be bloat, really the proper term is GDV, or again, gastric dilatation with volvulus. So what we find with this disorder is deep-chested dogs tend to be predisposed. And some of the more common breeds that tend to have a higher predisposition for it are actually going to be Great Danes, St. Bernards, and my beloved Weimaraners, but they are among some of the top breeds reported to get this disorder. The disease increases with age, so the risk goes up, because just like all of us, we all get saggy as we get older. Not me, but as these guys get older, the ligaments that actually hold up their stomach and keep it in place, they start to stretch out, and so they're more likely to get this disease as they get older, unfortunately. Male dogs also tend to be predisposed, so we tend to see it higher in male dogs. We tend to see it in dogs that eat one meal a day. So if these guys are eating a large meal, that's going to distend their stomach a whole lot more and make it more likely to twist. Again, nervous dogs going to the kennel where there's a lot of stress, that can do it. Exercising after eating can increase the risk. So I usually recommend in these deep-chested dogs, especially if they're not PEG-CE'd, that they actually don't exercise after they eat for at least 2 hours. We don't quite know why this disease occurs. We know some of the risk factors for it, but we don't actually know the pathophysiology and how this disease develops at the time that it occurs. But what we do know is that as the stomach twists on itself, it takes blood vessels and organs like the spleen with it. And what happens in that situation is blood can't get to the heart, so get back to the heart from these organs, nor can it get to these organs. And so the reason this disease is considered to be fatal without prompt surgical intervention is really these organs start to die. And we can see in these patients that even after their stomach is derotated at the time of surgery, if the rotation had been going on for a long period of time, sometimes the organs that had lack of blood flow just won't recover. There's Luke, of course. He has to put in his 2 cents. Dobermans are also, because they're deep-chested, also have a risk of getting this disease. Clinical signs that we can see associated with bloat, some of the more common or classic symptoms include non-productive retching. So typically vomiting is not something that we see with this disease, and again, it makes sense that if the stomach is twisted on itself, the inflow tract, or the esophagus, and the stomach kind of get pinched off from each other. And so vomiting will actually be non-productive. They feel like they have to relieve the pressure in their stomach, but nothing can get up out of their esophagus and through their mouth, so they often will just retch. They can drool, they can have abdominal pain. Sometimes the dilated or distended stomach can actually be seen from the outside, so they can look like they almost have a pot belly or kind of goat belly appearance, but not always. Some of these guys, the stomach can actually be distended under the rib cage and it not actually be seen from the outside. So any dog presenting with acute abdominal pain, discomfort, non-productive retching, drooling, shock, collapse would be an emergency, and they definitely would need to get to a veterinarian right away. The way that we diagnose this disease is actually with x-rays or radiographs. And there's a specific view that needs to be taken to actually be able to see the stomach in an abnormal position. So usually it's something that can be diagnosed with a single x-ray, but again, we often will take multiple views because we want to make sure that we're not missing something else. I've actually diagnosed it with ultrasound a few times. Ultrasound is difficult because ultrasound waves do not penetrate through gas, and these stomachs tend to fill up with gas, and again, that's because the bacteria in the stomach that develops when nothing can get in or out of the stomach, gas actually interferes with ultrasound waves, and so we can't see into the stomach. But one of the things we can see with ultrasound in some cases is the outflow tract of the stomach. So even though it's kind of pinched off and closed off from the stomach, we can actually see that it's in an abnormal position. So instead of the small intestine coming off the stomach on the right side, we can actually see it come off on the wrong spot. So the middle of the belly, the left side of the belly. So I've been able to diagnose a few of these cases with ultrasound. Treatment, as I mentioned, if this is a surgical emergency, so the faster you can get these patients in, the better off they'll be in many cases. There are some tests that can give us an idea about whether or not the vitality of the stomach and the spleen and the other organs in the belly is still okay. So a test called a lactate can give us an idea of how much perfusion we've lost to these organs. It's still worth doing if you know that it's only been a short time since this could have happened. But again, it's something that can be fatal. Sometimes we can't save these organs even if surgery is implemented. Typically what we will do, and not me, I'm saying we as the veterinary field, the stomach will be derotated. Any contents in the stomach, if they need to be expelled, the stomach can be opened up. And then we always want to assess the stomach, the intestines, the spleen. Sometimes the spleen needs to be removed at the time of surgery, and again, dogs can do very well without their spleen. And the stomach will actually be adhered to the body wall to prevent this from happening again. Now, the hard part with that is I have seen some cases where the stomach can still turn on the PECSI site, but it's very, very rare and uncommon that happens. So getting a PECSI at the time of surgery is definitely the route to go. And that actually is one of the best preventative measures that can be done. So if you have a deep-chested dog, or especially a brood that is predisposed, getting a PECSI either at the time of a previous surgery or at the time of a spay or neuter is the route to go, and that way you don't have to worry quite as much about this disease developing down the line. Treating any sort of disease that could have predisposed these guys to it also can be helpful. So we do tend to see that dogs with underlying GI diseases can be predisposed, and we think that is because the gastrointestinal disorder can impact motility of the stomach and intestines, so treating that can be helpful. And then again, offering multiple meals a day rather than one meal. There really isn't any evidence that doing a raised bowl really helps, but anything you can do to slow your pet down so they're not kind of gorging themselves, preventing exercise after a meal, all those things can be helpful. I have seen patients that after surgery, they can continue to get bloat where their stomach actually can fill with gas and they can be uncomfortable. But again, as long as we can PECSI them, the likelihood of their stomach actually rotating again is very, very low. So again, it is a disease we see. It is something to be on the lookout for. And again, non-productive retching is one of those hallmarks that, anytime I have a client that says that, I say you need to get into a vet right away. It might not always be that, especially if it's a small brood dog, but it is something that we would need at least that x-ray for to really rule out. And so any dog is at risk for it, and so I recommend taking it very seriously. Again, this is more of a surgical disorder, so it's not quite in my wheelhouse, but I've definitely seen these cases when I worked emergency. I've seen these cases as an internist doing ultrasound, so it is something we see with frequency, unfortunately. And again, pexiing your dog as soon as possible is really the best way of preventing this from happening. I hope you enjoyed this video. Please comment, please subscribe, please follow me. I'm going to keep coming out with more videos for you guys, but any content you'd like to see, let me know. All right, thanks guys.